Hi, my name is Dr. Karen Herbst, and I'm an endocrinologist in San Diego. And I wanted to talk to you today about breathing. This is a second part in a series of 2 videos to talk about how important breathing is if you have a fat disorder. The fat disorders that I'm referring to include dercums disease or adiposis dolorosa, Madelung's disease or multiple symmetric lipomatosis, or familial multiple lipomatosis or lipedema. The last time I spoke about breathing, I talked about how important it is to use resistance breathing to increase the strength of your diaphragm and to help move the lymphatic fluid throughout the lymph system in your body. What I've noticed recently, and because of a couple of patients that I've seen who have problems with dercums disease, pain, fatigue, and also breathing, is that there is a component, not necessarily a full diagnosis, but a component of thoracic outlet syndrome. And what I mean by that is on the upper part of your thorax up here, a lot of people who have fat disorders tend to stoop over. They do this because they have a lot of fatty tissue on the lower part of their ribs that is painful, because they have a lot of fat tissue on their back, for example in Madelung's disease. They have a lot of lipomas, especially up here in the supraclavicular area. They have a lot of pain and just general fatigue, and they tend to stoop. And also, when they sleep, they tend to sleep in a tight ball. If you increase the pressure in the upper part of the thorax, then you not only affect the great vessels in your chest and your ability to breathe, but you also decrease the ability of the lymph to flow through your system, because lymph from the thoracic duct on the left empties into about right here on your neck, and lymph from in the right thoracic duct empties about right here. So again, it's all in the upper part of the chest. So what I would like you to do if you have a fat disorder, or you can tell someone if you know someone who has a fat disorder, is to open up the upper chest. So when you take a deep breath, I ask that you just lift up your upper chest and take a deep breath and let it out. And just keep breathing that way for about 10 counts. And a lot of people who lift up their chest say that they can actually take a deeper breath than when they're hunched over. So resistance breathing is important, and I showed before that you can use a hole in your fist as resistance and take a deep breath to exercise your diaphragm, but also lifting your upper thorax. If you think you might have a component of thoracic outlet syndrome, such as pain radiating down your arm, numbness or tingling, any kind of autonomic symptoms, or if you just have a fat disorder, you can ask your healthcare provider if they would be willing to test you for thoracic outlet syndrome. You can also just go on to the internet and use, for example, the search engine Google and look for exercises for thoracic outlet syndrome. And there are quite a few websites with great pictures, and you might bring these to your healthcare provider or your physical therapist and ask if they can help you. Thanks a lot, and goodbye from San Diego.